Health is our most precious asset. Good health and well-being enable stronger people to reach their potential drive and foster stronger communities. Governments have a role to play in building good health by ensuring policies, frameworks, and standards for health and well-being in place and acted on. They must make sure that the cost of using services do not put people at risk of financial harm. The attainment of the highest standard of health is one of the fundamental rights of every human being, and the goal of governments, without any distinction of race, religion, political belief, and socio-economic conditions. Improving the well-being of family is an important public health goal. Their well-being determines the health of the next generation and impacts future health challenges for families, communities, and the health system. At a time of limited resources and competing priorities, there must be a need to ensure that each financial decision positively impacts patient care by improving the quality of services provided and maintaining accessibility and affordability for patients. Moreover, effective financial management is essential for fostering partnerships, driving research and development, and ultimately bolstering the overall performance of healthcare institutions. UHC is based on the principle of equity, non-discrimination, and the right to health, ensuring that the most marginalized populations are reached and covered and no one is left behind. The goal of universal health coverage appears to have become more attainable as the world has become richer, leading to greater access to health services and technologies such as vaccines and antibiotics, biomedical equipment, and to the most dramatic decline in poverty ever achieved. To ensure that everyone benefits from the human right to health, political leaders have to make the right choices, the rational economic, financial, and social choice of universal health coverage. Investing in universal health coverage improves equity and social cohesion. It also benefits the national economy by improving health and well-being, increasing workforce participation and productivity, and building resilience in individuals, families, and communities. Despite all the aforementioned, globally, 4.5 billion people still do not have access to essential health services. Financial protection has progressively deteriorated over the last 20 years, with 2 billion people experiencing financial hardships and 1.3 billion people pushed into poverty due to health spending. And that is from the World Bank, the World Health Organization, sorry. St. Lucia, though just a very small island in this vast world, is not spared from this. But what have we done at the Ministry of Health to change the situation? The Ministry of Health, Wellness and Elderly Affairs has worked alongside sister agencies at the public level, private level, regionally, and internationally over many years, and we're looking far back as 20 years or more than that, to push the UHC agenda forward. As recently as August 30th, 2022, the Universal Health Coverage Unit was established. Initially with one person, and afterwards we had a secretary join on board soon after. As time progressed, more staff was added to this unit to allow successful implementation of services under universal health coverage. Maternal and Child Health Services was launched on June 1st, 2023. More than 1,871 pregnant women received their laboratory tests under UHC during the period of June 2023 to October and 2024. More than 2,955 ultrasounds were done for pregnant women from June 2023 to November 2024. The performance-based financing pilot project, what we know as the PBF pilot project, was launched in 17 wellness centers in August of 2023. From August of 2023 to October of 2024, the PBF pilot had 25,000 168 persons above 18 years of age using this service, which actually forms about 53% of the population in the areas where these 17 wellness centers are located. Of that number, 1,837 persons were treated for hypertension and 1,030 were treated for diabetes. In August of this year, we also launched cervical cancer screening and HPV testing. We transitioned from the conventional method of conducting pap smears to a more advanced liquid-based cytology. This is a positive thrust forward as the Ministry of Health works towards the elimination or eradication of cervical cancer in St. Lucia, which is a WHO instruction to allow persons or countries to push forward to eliminate or eradicate cervical cancer. Thus far, we have 1,577 women screened between August to November of 2024 at the primary care facilities. As recently as December 2nd of this year, we relaunched Men's Health Clinic with the expanded service to include new services of PSA testing for men at no cost and access to urology services if needed to include ultrasounds and biopsies at the primary care level. Snake bite management is another service to be launched within this financial year, 2024-2025, under universal health coverage. The Ministry of Health started with a snake bite envenoming symposium, which took place on November 28th to 30th of November this year, where we were graced with the presence of 20 snake bite specialists from islands and countries around the world. Local farmers, emergency medical technicians or firemen, the clinical staff, and the forestry officers were given the opportunity to be trained at no cost to them. During this upcoming financial year, which is 2025-2026, the Ministry of Health will work towards the launching of breast cancer screening and the expansion of hypertension and diabetic screening and treatment to the pending 17 facilities under primary care. As screening and treatment has already started at the primary care facilities, at 17 of them, so we need to expand to the rest. Launching of this service and all of these services that were aforementioned came with various sessions of training, capacity building, development of standard operating procedures, key performance indicators, development of service level agreement, engagement, of course, of the private sector services, and the communication material, including media appearances to educate the public. A lot of work has also been done when it comes to UHC financing. How do we finance UHC? The Ministry of Health had worked alongside the World Bank and other ministries to develop the draft health financing policy and strategy for UHC. Joint Independent Professional Association, or what we call JIPA, has also been recently engaged in October of 2024 to assist with driving the UHC finance agenda forward. The aim is to find a sustainable financing model for UHC, which will be able to fund all the services we have within the essential package of health services, which we plan to offer the population of St. Lucia. Community sensitization continued over the past year as we met persons from various communities during regular working hours and after working hours, including the weekend. The UHC unit has also started sensitization at schools with the aim to continue at schools and community in the year 2025. Meetings or knowledge exchange happen at local, regional, and international levels, allowing us to have a better understanding of UHC, our challenges, successes as well as others. Special mention must be made to the Health System Strengthening Project under the Project Implementation Unit, as without their support, no offense to you, Accounts Department, Ministry of Health, but without their support, we would not have been able to make such gains that we've done from 2022 until present. And knowing that there is a call on International UHC Day of this year to all governments to invest in health for all and the protection of persons, particularly the most vulnerable within our population, and to avoid the impoverished spending on health, the Ministry of Health will continue to push to improve health conditions for St. Lucia, as there is a clear awareness that it is a national imperative for the well-being of our people in St. Lucia, for economic prosperity, and for sustainability of the health of our people. I thank you.